Hello, everyone. My name is Tiara Brooks, and here at SchoolBased Health Alliance, we would like to thank everyone for attending today's webinar titled, Creating School-Wide Conditions for All Students to Thrive. Part 2, Building a Team and Engaging Your Partners. Today's presentation will describe the benefits and process of creating a school-wide wellness team to achieve a vision for school-wide wellness. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the chat icon located in the Zoom toolbar. We will address all questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. Now let's begin using the chat box. If you are viewing as a group only, please go to the chat box and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. Again, this only applies to those viewing as a group. This will help us with our final attendance count. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based health centers through technical assistance and training. We advocate for SBHCs on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. I will now introduce our presenters for today. Jordana is a program manager at the Alliance and manages our Hallways to Health initiative. Sarah Trevette is the primary care provider and health educator at Turner Elementary School-Based Health Center in Albany, Georgia. She participated in the Hallways to Health initiative and will discuss the accomplishments and what it took to create school wellness teams to reestablish a district-wide wellness committee. I will now turn it over to our first presenter, Jordana.
Thank you so much, Tiara, and thank you so much, Sarah, for joining us today. Our objectives for today are to identify 3 individuals to include on your school wellness teams, list 2 ways to engage partners in your school-wide wellness efforts, learn about Turner Elementary School and district wellness teams, Hallways to Health accomplishments. Last time, we introduced Hallways to Health as a model for school-based health centers taking the initiative to move beyond the clinic walls and lead school-wide wellness efforts. You may think of these as population health. A health promotion effort is to increase health equity throughout schools and create conditions that promote health and enable all children to thrive in the classroom. Hallways to Health is a project of Kaiser Permanente Thriving Schools, supported by the development of this training as a part of its national effort to improve the health students, staff, and employees, and teachers in K-12 schools in the following focus areas: healthy eating, active living, school employee wellness, and social and emotional health. Hallways to Health increase buy-in and engagement in school-wide wellness efforts from school-based health center staff, school administrators, parents, community-based organizations, youth, and school employees. The sites created programs, policies, and procedures to increase food security, healthy eating, neighborhood safety, and to create safe and positive school climates, school environments, and to address social determinants of health. Hallways to Health sites found that engaging in these efforts benefited their practices too. They found increased SDHC referrals and utilization. They found increased buy-in and support from schools and communities. And now we're working towards national scale-up. That's where you come in. So thank you so much for joining us today. We hope this training will give you the tools and skills to be a part of this shift. We wanted to share with you the general steps towards school wellness that our Hallways to Health sites took to begin this cohort: building, engaging, assessing, implementing, and sustaining. Today, we'll talk about building your team and engaging with partners from school, youth, parents, community, and community-based organizations. In the next webinars, we'll talk about assessing conditions for wellness and implementation. If we want to achieve school-wide wellness, we must permeate every facet of school life, from the classroom to the cafeteria, from the campus to the neighborhood, and from student support services to the attendance office. This requires active involvement of all who have a stake in student well-being and academic success. Whatever the name, wellness committee, council, task force, a diverse coalition of school and community stakeholders, champions, supporters, and implementers serves many functions. In the chat box, write why you think a wellness team might be important. Yep, wellness teams increase visibility to reach more students and families. And the diversity absolutely increases the coordination and connectedness. Teams also drive innovation and can offer help or support, and as well as different skills or resources and connections. Teams can also share the work, the time, and the support of your school wellness efforts. This group can establish a compelling vision for school-wide wellness, set actionable goals and objectives, and align resources and partnerships. A diversity of membership on the team will fuel broader community connections and resources and will generate more innovation. You want to be sure to work with your team to develop the mission, vision, and objectives of the wellness team. Raise your hand. You can use the raise your hand feature. Do any of you already have existing wellness committees? Looks like a few of you, 3, 4, 5, several of you already have wellness teams. Awesome. So when we're thinking about a wellness team, we also want to think about how to utilize the teams that we already have and to move them into thinking about and acting on school-wide wellness instead of just, using it to share individual data or things like that. So great. So changing school climate to bring about school-wide wellness involves the participation of a variety of stakeholders. We talked about this. We want to make sure that the stakeholders involved in your wellness teams represent your SBHC in the clinic. They represent partners in the greater school environment as well as in the surrounding community. Success is far more likely to be achieved when the desire to make changes is shared and owned by a group of diverse stakeholders who invest in a shared vision. In Hallways to Health, sites identified folks to serve on the wellness team and created and revived infrastructures to make it happen at the school and at the district level. And we'll hear a little bit more about that from Sarah today. But you want to make sure that you're selecting and recruiting your members for your school wellness team strategically so that you're building buy-in and support for your wellness team and for your efforts. As the slide shows, the team should include representation from the School-Based Health Center, your school, and the greater community. Some possible team members include teachers, principals, health educators, clinicians, parents, or parent coordinators, and student leaders. We want to make sure they're passionate and qualified, and that they represent work across systems and sectors. Now, yours don't all need to be from TV shows like we've included here, but mention in your chat box if you already have a wellness team or if you'd like to create one, who else might you include? It might differ if you're coming from an elementary school, a middle school, or a high school based on the resources that you have available to you. Parents, yes, parents are definitely a wonderful group to include on a wellness team. They can speak to their student needs and connect with other parents. Yeah, a lot of people say parents. Great. Okay, so and moving on, in our toolkit that we'll be releasing shortly, we include a tool called the Team Roster. It includes recommendations to help identify team members to implement or sustain school-wide wellness efforts. So if you don't already have that team in place, this is a tool to help you think about who you might want to include. And again, who can share ownership of the tasks and reduce burdens on any one individual. The tool will help you think about who needs to be involved to get it going or to keep it going, or how you can utilize the team to get buy-in if you already have a team that's similar, but you want to think about moving towards school-wide wellness. And then, of course, you'll want to codify the authority and functions of the team. So define the wellness team's scope, roles, and responsibilities, and then make sure that everyone is kind of on board with that. You'll also want to just make sure that you formally decide together the frequency of your meetings, how you'll make decisions together, and who will own the work. It's a small piece at the bottom of the screen, but it's who will own the work, who would be a consultant on the work, who would help, and who would approve, and who would manage. So Sarah will talk a little bit more about this on how she created her school wellness team and who she included in just a few moments. Okay. Awesome. In addition to the wellness team, you might have some other partners you'll need to engage as you're embarking on school-wide wellness efforts. You guys have mentioned some of them in the chat box: principal or assistant principal, local community partners. Awesome. Those are all definitely groups you might want to engage, whether it's on your wellness team in an ongoing fashion or kind of like in an ad hoc manner. So partners will strengthen your relationships and garner essential buy-in from those who can enhance and sustain your school-wide wellness work. Partners can also help you implement. So some of you mentioned local community partners, like food banks, can absolutely come in and help implement, promote, and support your school-wide wellness efforts. And so in our toolkit, we offer some strategies about how you might engage some of these partners in simple ways. So identifying strategic opportunities with existing organizations in your area for collaboration coordination, identifying those who might be affected or impacted by your school wellness efforts, conducting asset mapping to see who's already doing what and providing what services to your community. And then you'd work to develop a stakeholder engagement plan based on that asset map and determining which organizations and which individuals can help you advance your school-wide wellness mission. So in the chat box, can you think of anyone else who you might need to engage to implement some of these school-wide wellness initiatives? Again, these can be stakeholders who are both in or outside of the wellness team. Okay. Great. Neighborhood businesses, school administrators, social workers, guidance counselors, school safety personnel, social workers, classified support staff. Yeah. Definitely. You guys all absolutely understand, what it takes to think about how we're coordinating care and coordinating services and information here. School food authority, awesome. Neighborhood businesses, school administrators, again, wonderful. So we definitely have to engage our school partners, our school administrators, our faculty, and all of the support staff, which many of you mentioned here, is critical to the success of school-wide wellness initiatives. And for school-based healthcare, to influence the culture of schools itself, the people within the education system, from top to bottom, must be enthusiastic participants. In Hallways to Health, when the school-based health professionals demonstrated their commitment to the school's priorities as well, the school support followed. So conducting outreach to school leaders increased the school-based health center visibility, trust, and promoted involvement with school-based health centers and with wellness teams. Involving school leaders was important because the collaboration increased the teachers' referrals to the SBHC, and a variety of partners demonstrated the value of school-wide wellness and shared the importance of it together. Each of these partners was also involved in promoting school-wide change together to improve overall the health of the school and the student population as well as the staff. So some of you mentioned that the principal or school leadership would be really good people to involve. So I just wanted to provide an example here about how to get a school administrator kind of like involved and engaged in your school-wide wellness efforts. So In the first column, I identified who the audience might be, so the principal. We want to talk about why you might want to get them involved. A principal can approve school wellness efforts. A principal can encourage staff, parents, youth to support or attend school wellness efforts. And a principal may even be able to offer funding, space, time for your school wellness efforts. What barriers or challenges might you anticipate from a principal? We've heard from many Hallways to Health sites that principals, have many demands on their time. They have competing priorities such as their academic outcomes and absentee rates. And they may feel that that's separate from the school-wide wellness work, when in fact it's not. A principal maybe hasn't considered how an SBHC can be a useful partner for the non-clinical work. So we want to determine strategies about how to engage the principal first, and then make sure that we're crafting messages to engage the principal and increase the buy-in as well. So one way that our Hallways to Health sites were successful at engaging school leadership, we're taking the time out of their day to attend faculty meetings and school-wide events. Showing up and being seen was really key to building relationships and building trust with school leaders. They also invited the principal to sit on their wellness team. So many of you said that in the chat box earlier, that administrators are people that you'd want to include in your wellness team. Absolutely. And then other school-based health centers asked for meetings to pitch the ideas of wellness, school-wide wellness, and asking about other committees or meetings that the principal holds that would be useful to the school-based health center to attend. Here are some messages that some of our school-based health centers shared with school leaders to get them on board. Again, connecting the goals of the school-based health centers with school-wide wellness and the academic outcomes. We'd like to help you increase attendance. Let's work together to identify the top chronically absent students and to work with them to determine what health, academic, and home factors are preventing students from coming to school. We've learned that from our patients that many students are unable to cope with stressful events like bullying and pressure from home and school. We'd like to offer some training to the teachers and students to provide them with skills and tools to use to de-stress. Sorry about that, there's a typo there. It says distress, but we meant de-stress and process. This will translate in the classroom as well. So again, using your school-wide wellness efforts as an opportunity to connect with school leaders and to talk the same language and get on the same page about how to improve health and academics for students. Another group we'd want to make sure that we involve is the youth. The young people are obviously the most important actors in their own healthcare, and partnering with young people provides insight on the services that they need, the programs that they need, the policies that they want, need, and expect from us. And young people can provide deeper insight into the social determinants of health that they face, as well as meaningful actions to get towards the conditions necessary to achieve school-wide wellness. You want to establish partnerships with youth. Again, youth, apologies about that, and create an environment where youth can share their opinions, values, and concerns by creating and formalized youth advisory committees and working with other student organizations to provide leadership opportunities and opportunities for students to be participants in school-wide wellness efforts, mentors in school-wide wellness efforts, etc. In the chat box, I'd love you to share your favorite strategies for engaging youth. And we have a youth engagement toolkit which provides additional tools and tips as well if that's a population you're struggling to engage. Great. Another group that you guys mentioned is parents and guardians. Absolutely, we can't forget parents. Parents and guardians have high interest in keeping their children and youth healthy and safe. They can influence and encourage healthy behaviors by serving as role models for their families, and they can collectively influence teachers, principals, and school boards to ensure that policies and systems are in place to create the healthiest and safest environment for their youth. We want to make sure our parents and guardians feel valued. We want to engage them over the course of the year regularly, and as the school year ends and a new school year begins, as there's new parents, even in the middle of the year. We want to utilize the parents and guardians as volunteers. So in Hallways to Health, some of the sites utilize parent volunteers to help with a walking school bus, or to help coach a Girls on the Run club, or even just to help with family and parent engagement nights. And there's a lot more stories and tips in our toolkit that'll be coming out soon. So just another quick example about engaging parents. So who might you want to engage, parents or guardians? You might want to engage parents or guardians that are new to the school or the community. These parents or guardians could include parents or guardians that are transplants to the area, or maybe parents or guardians with first children in school, or maybe parents or guardians that are new to the country. So why might we want to engage them? We touched on this a little bit before, but we want to establish relationships and trust within the school-based health center. We want to work with parents to connect them with new and other parents and guardians, as well as other students down the road. We can also utilize the parents as an opportunity to connect families with other resources and services, which we're not able to traditionally do just with the students on their own. And as we just talked about, parents and families can offer in-kind services and volunteer their time as well. So what challenges and barriers do you anticipate for parents? One challenge that we've seen often is that parents say that there's no time, or that they're not exactly sure what the school-based health center does, why they should get involved, or maybe even that they may mistrust the school-based health center or other school or health authorities. Parents may be struggling with their own health, housing, jobs, or transportation, and parents and guardians may not speak the same language as their children or as the school-based health center practitioners. So what's a good tactic to engage our parents effectively? Our Hallways to Health sites utilize parent and family engagement nights as health education opportunities to teach about child and adolescent development, to teach about bullying, but then also to teach about nutrition and cooking. Our Hallways to Health sites asked their parents and guardians about their own social determinants of health and connected them with resources, with other social service resources, and enrollment in social service. So bringing in health insurance enrollment specialists, SNAP enrollment specialists, and WIC enrollment specialists as opportunities when they knew the parents were going to be in the school, and to connect them with their own resources. In partnership with the school, the school-based health centers also sent texts, emails, with health information and updates on programs and things like that as well. The messages that Hallways to Health sites use to engage their parents are: how can we make sure your children are healthy and well? What services can we offer to make life easier for you and your family? And just sharing general information about school-based health centers themselves. We aim to provide affordable, accessible services to the students who come in the SBHC, and we're trying to do that throughout the school. Messages of welcoming and safety. So we welcome students and families of all races, genders, and sexual identities. And talking about how you and your children can feel safe in these environments. Talking about confidentiality policies, privacy policies, etc. So that's just another quick example of how you might be able to utilize parents and guardians in ways that you're probably already doing within your clinical efforts, but then again to thinking about how to move beyond the clinic walls and provide school-wide wellness efforts as well. Another group that you might want to engage, which many of you mentioned in the chat box, are community-based organizations, local businesses. Absolutely. Community-based organizations, local businesses can provide resources and funding to enhance your school-wide wellness efforts. They share your vision for healthy communities. They often can offer valuable insight on the conditions necessary for health and wellness within the community based on their established programs and their established trusting relationships. So you want to engage them by, again, finding and prioritizing the partners that successfully serve your population, and discuss ways that you can support them, promote them, and expand what they're doing. You can build formal partnerships with them, and you can invite them to serve on your school-based health center advisory boards or wellness teams, and you can share together the limelight of if you create a wellness program together, how the community-based organization was involved and how your school-based health center was involved. In the chat box, you can write if you have engaged any community-based organizations and how you might have done that. You can see at the bottom of the screen that some of the organizations that some of our sites have engaged included a local grocery store, Trader Joe's, Home Depot, and Parks Department. Great. So once you've decided who you're going to engage and when, you can use this tool. It's called the message box to craft your ask and initiation. This will help you organize your thoughts and identify key points to communicate to your audience. It provides a simple schema for a conversation, and kind of doing this as pre-work before you meet with any of your partners ensures that you have articulated a clear message for each stakeholder. So you can see you would begin with identifying the audience at the top, and then you want to move to writing in the big box in the middle what the kind of issue that you would aim to solve is. So if you're thinking about access to nutritious food within your school, you might want to write that. And then you would articulate the problem specifically. And then the so what asks, why does this matter to my listener? And then you'd move to what the potential solutions are and what actions you'd want the listener to take or support. And then you'd conclude by listing the benefits to your partner. So how would my listener benefit by resolving the problem? And again, this tool will be available in the School-Wide Wellness Toolkit. Another tool we'd like to show you is the Stakeholder Engagement Plan. So once you've picked your partners and stakeholders and you've crafted your messages, this tool will help you outline your stakeholder engagement strategies. It'll help you identify who your top stakeholders are, what their interests and influences are in school-wide wellness, and how you're going to involve them over the course of time in your efforts. So we also include a tool to narrow down your partners, and identify, get down to, this tool has like the top 4. So you would get to the top 4 stakeholders, and if like youth are one of the stakeholders you want to engage, you would have different approaches and strategies to engage them than parents and things like that. I'll now turn it over to Sarah Trevette, who is one of our wonderful Hallways to Health champions at Turner Elementary School in Albany.
Hi, so yeah, I'm the, like they mentioned, the primary care provider and health educator at Turner Elementary School-Based Health Center in Southwest Georgia. And so just to give you a little bit of background, and I'm working on trying to get this, I'm clicking and it's not moving. Oh, there we go. It is not moving forward. We're a small office of about 3 people. And so this work can be done with a small staff. And so just wanted to let you know, like, that through, sorry, trying to get to the right slide, but through, there we are, through our dedication, like our sponsoring agency has been able to expand school-based health centers to 3 additional school districts and 4 additional sites in the district that I work in. So, you know, Jordana has kind of gone over a lot of this, but this is just sort of our particular story. And it sounds like a lot of you are very familiar and, have great ideas already on developing your own wellness committees. So, developing a wellness committee, the reason why is just like we've talked about, the opportunity to impact all the health and the wellness of all students in the school and the district, whether or not they come through our doors or not, because, we all know that healthier students are better able to excel in school. It really allows us to focus on that policy, system, and environmental changes. And in our particular district, there's over 15,000 students and around 500 students at my particular school. And so through the work that we've been able to do with our district and school wellness policies, we've really been able to positively impact, all 15,000 students, which certainly I don't see all of those students in my school-based health center. So it's been a great opportunity. So, getting buy-in to develop these wellness committees, and by the committees, I mean both a district and a school level committee, because it really is important to have both of these. The district committee sets policy for the entire district and directs overall policy, but the school wellness committee is involved in implementing that district policy at their local level, and also possibly even going above and beyond the district policy by having a strong school wellness committee. We were able to promote recess and healthy eating well before the district wellness policy was willing to put that into play. And so we were able to highlight to the district what can be done so that they were more likely to then change the district policy. So, but in order to get, buy-in for developing both a district and school level wellness, we focused on a lot of the things that have been talked about. We focused on getting the buy-in from our sponsoring agency, our school-based health center staff, our school administration, our district administration. So for the, sponsoring agency, they have to be the first person to buy into the importance of expanding your reach beyond the walls of the clinic, because, they're really the first line for promoting the activities and events that you do outside of your school-based health center walls. And for sites that don't necessarily have a dedicated health educator, it may require blocking some of the provider's schedule so that he or she has time to do these activities. We've also really worked to utilize our school-based health center advisory board as a great way to get buy-in and support, and to get a team together to help so the provider isn't the only one doing the activities, so that it's really a team approach, and that way, it can lead to sustainability so that I'm not out of the clinic all of the time. Next, so like I mentioned, we have expanded our school-based health centers greatly since being involved in Hallways to Health, to include 3 additional school districts and more sites in my district. So we've really worked hard to try and get all of our school-based health center staff on board to why is this important. So they've each been tasked with developing district wellness teams as well as local school wellness teams. And so we worked to get our school-based health center staff buy-in for this by having an annual school-based health center retreat to demonstrate our continued commitment to impacting all students, whether they utilize the school-based health center or not. So at our first retreat, we had a lot of new providers to school-based health center. So we just really wanted to make sure, do you understand what the core competencies of a school-based health center are? Because when you do that, kind of, doing this work sort of flows seamlessly. Also, we wanted to get to know each other so that we all, were working as a team and had each other's back. And then worked on, defining success. So what's it going to look like, and what does it take to get there? And so then really defining and describing what is our mission, vision, and core values as a school-based health center department. So the staff answered, who are we, what are we doing here, and who are we serving? So that way, when you're going above and beyond, just, seeing your patients, that kind of thing, because it does take work. They can kind of always keep that in mind. And again, just kind of remembering that it's always about people. All of these, policies and things that we're doing are really to try and impact, people. So then from there, once we had buy-in from our administration, and then from our, our sponsoring administration and the school-based health center staff, working again to get that buy-in from the school and district administration. So for us, again, kind of, remembering that it's about people, so building those relationships. So, just talking, So, finding out who needs to be involved at the district level. In our case, at the district level, found out like school nutrition. They really needed to update the wellness policy because they had an upcoming review from the state, and so they were, going to be a big champion for this. We also had school board members who were excited about impacting the health and wellness. We had curriculum coordinators who felt passionate that if we were getting more exercise in class, that, their science and all other, subjects would be improved. The athletic director we found, was someone who was on board. And then we had parents who really, wanted to push this. Had a parent who is on the local newspaper and had written an article about how important it is that these kids have recess, and so, he was passionate about it. And students, of course, and then community members. And for us, like the community members that we involved were the YMCA, our local extension office, our Parks and Rec department, the hospital. Those are some examples of community members that were important in our particular area. And then in the school, the key players are, the school secretary is kind of the gatekeeper for everything. So having, her on board is really important. The PE teacher could really take off a lot of, could help with teaching best practice for recess and things like that to the teachers. We found the school counselor was super important, having our own school nutrition also on board, and even the janitorial staff, because, if you want to make changes on having a, breakfast in the classroom or something like that, certainly you want your janitorial staff to be on board. And so making all those connections, like Jordana mentioned, was a great way to, make our school-based health center more visible in not only the district, but also the school. And so, we then had all these key players in the district know about the school-based health center and see its benefit, whereas if we weren't involved in a district wellness policy and district wellness committee, they really may not have even known we existed because it wasn't necessarily on their radar screen. So it really was a win-win that we got the opportunity to help impact the students, faculty, and staff, but also we're promoting the sustainability and visibility of our school-based health center. So, when we got our key players on board, we wanted to make sure that we defined, what success looked like. And here are a few examples that our school wellness action team and district wellness committee came up with. And again, like I talked about the last time, so those key players were those community members, people from the school-based health center, the school nurse, parents, school counselor, PE teacher, principals. Those are people who were coming up with what do we think success is going to look like. So we said that we thought we'd have healthier students, we'd have happier students, we'd have improved access to outside resources, improved social determinants of health, decreased bullying, improved test scores. And so then we really took some time to think about what conditions does it take to get there, and how can we operationalize this into our care? So it really, required being very intentional and did take a lot of time and team building. So when when all the key players thought about what success looked like, we felt that the areas of focus of our wellness policy really did align with Hallways to Health priorities. We felt like if our students had access to adequate physical activity and proper nutrition, there was good evidence to say that it would positively impact their health, that it would impact their happiness by, learning those social skills and soft skills that recess teaches. Also, if we can help develop policy that addresses social and emotional health, we're more likely to keep kids in school, less suspensions, less bullying. And if our faculty and staff are healthy, that they're modeling healthy behaviors and are present in school, that's certainly going to positively impact the students, because when a teacher's out because of illness, it's kind of a lost day of learning for the students. So that, if we can keep our teachers healthy and in class, they're teaching the material, the kids, test scores, things like that will improve. So all of that got to the bottom line of really trying to increase test scores and improve academic achievement, which, are things that are important to a school. So in our particular area, our first two focus areas were physical activity and nutrition. Just a little bit of background at our school, there had been no recess on the master schedule for years. When they do something called a fitnessgram in Georgia, and 37% of our first through fifth graders fell outside the healthy fitness zone. We also did a RAPS survey on our 4th and 5th graders, 52% of students felt that they needed to lose weight. And prior to implementing recess, teachers reported an average of 12 minutes of activity a day, and that's including, PE, because they didn't get it on a daily basis. So really, our kids were not hardly moving at all. And then also 100% of our students at Turner and throughout the entire district do qualify for free and reduced lunch. So when we thought about, so what are the possible solutions to try and help with, getting to our goal? So first, we thought about, okay, so in the district, at the district level, can we update our district wellness policy that, that recess needs to be on the master schedule and that it cannot be withheld for remediation, makeup, class time, or discipline. For that, again, we had to start at the school level, making recess back on the master schedule and kind of prove to the district that it can be done. And then also in the district level, one of the things that we wanted was that all in-school fundraisers meet SMART snack guidelines. So those were kind of our two focus areas. And then also updating the local wellness policy. So beyond fundraising, we really kind of wanted to implement no food as a reward so that kids aren't getting candy for right answers, that, doing other things. And then really trying to incorporate this health and wellness into the, the school improvement plan and incorporating it into the PBIS framework so that it's kind of a seamless, seamless for the school. Just for our sake, we had a relationship already the district did with Alliance for a Healthier Generation, which was helpful to give some technical support to the schools. And so, at our school level, we were able to work towards bronze level certification for the Alliance for a Healthier Generation. We applied for grants so that we could get money to, help teachers buy pencils and erasers and things like that for the no food as a reward. And the schools love getting the recognition and money. And then the biggest thing that I felt was helpful with that was that many of these grants are tied to requiring policy change. So if you get this money, then we have to implement recess, and so it was kind of a good incentive. So other ways that we were able to update our local wellness policy was just putting in that we're encouraging brain breaks and we're even utilizing time before the school bell for physical activity. So the way, that we got buy-in for change was really by showing evidence of benefits of physical activity to give to the administration and to teachers. We worked hard to make sure that we gave them resources so that they could implement these things. And then again, of course, by telling those personal stories. So in our case, all of our faculty and staff have access to Go Noodle, and I believe it's free. So that, other areas could sign up for it as well. We were able to get a track built with grant funding. So and some of the grants we used were Action for Healthy Kids, Fuel Up to Play 60, and some state grants. We gave them resources on techniques to discipline without withholding recess so that you could still be holding kids accountable, but yet they could be getting, their energy out. We developed fundraising ideas that didn't involve selling candy, so walkathons, selling fresh fruit, t-shirts, having a school store, and then really utilizing each member of our school wellness action team to, for the parents to tell their stories, the students as an agent of change, teachers to help gain buy-in from other teachers and community members to help. So. And then just an example of what our policy change was to address the, obesity was the verbiage was all K through 5 students have 20 minutes of recess daily that cannot be withheld due to behavior for remediation makeup time, like I mentioned before, and that food sold directly to students during the USDA's definition of the school day shall meet SMART snacks guidelines. It was voted on by our school board in 2016, and local media has highlighted the policy change, and so, it was a big deal in the community. But lessons learned, see, I said that it happened in 2016. Well, we started this around 2013, 2014. So change takes a lot of time, and that, integration was key for these system and policy changes. So, it was a partnership between the school, the community, the parents, the students, and the school-based health center. We all needed to get, that buy-in together. And that, if we're going to continue that success, that we have to continue to have that follow-up. So it's not kind of like a one-year thing and then done. so that we, continue to have our school wellness team meetings and our district wellness meetings. And so, the big thing to know, being persistent, don't be discouraged. Again, it took us a lot of time. I hadn't dealt with school level administration a lot, but found out that, nothing just moves very quickly. So celebrate those successes, those small successes help drive more change. And again, utilizing your partnerships with your advisory board, the school-based wellness, our school wellness action team, that kind of thing. And then just being sure that, to set goals, and make the time to have the meetings and to develop a plan, because otherwise the school year passes so quickly, and before you know it, it's over, and then it's another school year. So we found that it really did help to be prescriptive and to have an action plan, and keep your heads up high, because it's hard work. So thank you. I'll give it back to Jordana.
Sure, and we had Sarah, you were quoted in another time, but again, about asking about being on your district wellness committee as a great way to meet decision makers, give them the idea of who you are and what you're doing. And if you know people and work in partnership, we can help move things forward. So I just want to say that I loved your presentation and your story. It's a real great example of engaging a variety of different stakeholders. You spoke about how supportive your sponsor organization was, getting your school administrators and leaders on board, and even getting your staff on board to think about their role in everyone's collective role in creating this vision for healthy staff and students in school, and identifying the approaches needed to take to be able to reach those. So that is really, really awesome. And I love that you talked about being able to impact 15,000 students, not just through the programming that you're working on, but through long-lasting policy changes as well, that will even, outlive Hallways to Health, types of programming, but that will impact so many students. So, I'm just wondering, Sarah, was there any kind of pushback to the school-based health center taking on this type of school-wide wellness work? And if so, what, if any, messages, in addition to sharing some of the resources, did you use to engage any of those different audiences about why this was important for your school-based health center to kind of take on?
Yeah. So yeah, I think that we were in a perhaps somewhat unique situation for some places. I mean, we're very fortunate that we, from the get-go did have good buy-in from our school administration and even from the district administration. I think intuitively they knew that these things were good things. However, that didn't necessarily, equal, let's make these changes right away. So one of the biggest things, was, again, just being persistent that, okay, we're all in agreement, that these are, good ideas and would be helpful for the students. So what are we going to do to make this happen? And again, that took, I thought, oh, everyone's on board, so this will happen soon. No, it took years. So, so really being persistent, and then being able to show evidence, to the school board when they're voting on, whether or not to, improve this or not. And then even now we did have some pushback from other principals, not my own, when wanting to do a district level policy about recess and things like that. So just being able to tell stories about how it's been done safely and that kind of thing, and give evidence, and also those resources, so that people know how that they can discipline and that kind of thing. And working, to find ways where our priorities can align. So, just trying to find that common ground. But we were very fortunate that I don't know if we got as much pushback as some places would. It just, I think they were happy to have someone else kind of do the work for them. And so we kind of were able to step up and do that. And so some other places may find that they're on board, but it's just they have a bazillion other requirements and things to do as well. And so it kind of gets pushed to the back burner.
Right. But it sounds like the collaborative nature of the work, the partners that you involved in your school wellness action team and your advisory committee were really helpful in making sure that it got done and moved along.
Exactly.
Great. Well, I'll turn to Tiara, who's going to just instruct on how others can ask some questions.
Yeah, thank you so much, Sarah Jordana. For our attendees, if you have any other questions for Sarah or Jordana, please enter your questions now into the chat box. And while we give others an opportunity to enter their questions, we do have a few more announcements. I want to just talk about briefly our membership. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. So please take a moment after the presentation to visit our website to know more information. I've also entered the link within the chat box if you want to know more about our membership. And please join us for our 2018 National Convention in Indianapolis, Indiana, June 24th through the 27th. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Also, Jordana will be presenting at our pre-conference on June 24th on promoting schools as hubs of wellness, the Hallways to Health model. She'll be joined by Manny LeBlanc from Washington School-Based Health Alliance in introducing the Hallways to Health Toolkit, key steps to using the population health approach, and provide tools and resources and examples to help SBHCs build, assess, implement, and sustain their efforts. Also, if you want to know more about the convention, I have also entered that link within the chat box. And also, we'll be having a free pre-conference. The interactive workshop equips you to use motivational interviewing to improve your ability to identify risk behaviors and social determinants of health, communicate effectively with teams, and motivate them towards healthy decisions. So we ask that you also join us on June 24th for another pre-conference. And we also have our Be the Change Youth Training Program. Each year, students from across the country come to join the network with each other in school-based healthcare advocates and participate in various workshops pertaining to health, education, policy, and leadership. For more information is on our website, and you can also use the convention link that is provided with you in the chat box. And scholarships are also available, and the deadline for the scholarship is May 11th, 2018. And we also have upcoming webinars that will go along with this series, and I'm actually now going to add in there the link for those webinars. If you would also like to sign up, or for any other webinars that we do have on our website, the link is also provided in the chat box. So we ask you to join us for our next one on Tuesday, May 8th, 2018 at 2 p.m. Eastern for part 3, Assessing the Conditions for Wellness and Planning Action.
And just on that note, Tiara, I think that's a great segue to also ask Sarah another question that came up here in the chat box. But you mentioned types of alternative discipline approaches that you talk to teachers about. Can you tell us a little bit more about that?
Sure. So I can find the resource, and it came from like Michigan or it was a sheet of paper that described, other things that could be done. So, potentially instead of, and you'd have to find the law at your own state or whatever, but in order to continue to hold kids accountable, some of the things that they recommended would be potentially having an additional assignment or something sent home, or instead of having the opportunity to pick from 3 different activities, they had the opportunity to pick from 2 or something, so that it was that they still had the opportunity to be active and do the things that that they wanted to do, but had a little bit less freedom, and so weren't but weren't standing on the wall or anything like that. Also, talked about potentially, having them, they can, you know, write like an essay or something, you know, about whatever they were, you know, the issue was, that kind of thing. And so there was just a variety of techniques of things that, you know, could potentially be done versus withholding physical activity, because most of those students needed physical activity. But I can send the, like how can you distribute that to everyone? Because I can send a link for that piece of paper for that.
That's great. We can send that around with our follow-up to the webinar to everyone. That'd be great.
And we'll also upload it on our website, which the slides and the recording of this presentation will be uploaded to our website in 3 to 5 business days, and we'll send a follow-up email just to remind everyone.
Okay.
That'd be great. Perfect. And with that, I think we're good. So thank you again, Sarah. But before everyone leaves today, we'd love you to just evaluate in these quick poll questions this webinar. So think about the role of school-based wellness and the themes of building a wellness team and engaging a variety of different audiences. So just take a few moments to do that. And we want to thank Sarah Trevetta again so much for creating a really thoughtful presentation for us and sharing a wonderful story about what was possible at Turner. And yeah, for just taking the time out of your day to do that. So thank you so much. We'll leave this open for another a minute or so, but then we'll look forward to seeing you on May 8th as we talk about assessing the conditions for wellness. And hopefully be able to see some of you at some in-person training opportunities coming up soon. Again, we'll leave this open for a few more seconds. All right, thank you again.